a couple of weeks back with history of multiple hospitalizations in the past with cyanosis and respiratory distress. He came to us. We did pediatric echocardiography to find out the cardiac condition. It came out to be severe tetralogy of Fallot, where there was a hole inside the heart which is called VSD, and there was a obstruction to the pulmonary blood flow from the heart to the lungs. So it was at multiple level, below the pulmonary valve, at the level of the pulmonary valve and above the pulmonary valve, and at the same time one of the arteries which goes to the left lung was small. So which is in technical terms called as left pulmonary artery obstruction. So the child had tetralogy of Fallot with small left pulmonary artery with ostial pulmonary artery stenosis. So I explained to the mother as well as the aunt about the complete cardiac condition, what we are going to offer as treatment, and what are the risks involved in this type of operation. And then with their consent, I took the child for surgery. We did tetralogy of Fallot correction in terms of closure of the ventricular septal defect, infundibular resection, augmentation of the main pulmonary artery, disconnection of the PDA, and augmentation of the left pulmonary artery. The child recovered very well. Within 24 hours of surgery, the child was extubated from the ventilator, and in another 24 hours time, child was off all inotropic support. Child was in ICU for 2 to 3 days, recovered very well, and post-operatively he was discharged by 7th day of hospitalization. So overall the operation went well. The recovery was very fast. He recovered very well, and I am happy that parents are very happy in terms of recovery. Now the child is very active and ready to go back to his own country, Somalia. Regarding our institution, this is a dedicated pediatric cardiac surgery unit at Apollo Hospital, Jubilee Hills, Hyderabad. We operate around 200 cases per year. We have a dedicated 10-bedded pediatric cardiac ICU with pediatric cardiac anesthetist and intensivists, and at the same time we have a dedicated pediatric cardiologist who does interventions in terms of pediatric congenital heart surgeries, and we have a complete dedicated team to take care of all subset of congenital heart diseases, starting from the simple congenital heart diseases to complex congenital heart diseases. We offer the extracorporeal circulation in terms of ECMOs, and we offer cardiac transplantation as well. So it is a completely dedicated unit of pediatric cardiac surgery comprising of congenital heart surgeries, congenital cardiac interventions, ECMOs, and cardiac transplantations. So we try to offer very reasonable type of treatment. We explain parents everything in detail beforehand before offering the treatment, and our offer in terms of financial assistance is much better as compared to any other equally developed congenital unit. We try to minimize our package in the benefit of the patient, and we try to stick to our offer whatever we promise to the patients, and in maximum cases we try to do justice for the patient in terms of treatment and in terms of financial assistance as well. Thank you very much.
My name is Sarah Ahmed. I came here with my cousin Abdifatah Salat Hassan, who is a patient for Dr. Sunil Kumar. We came here from Somalia, Mogadishu, and the reason we came here was for Abdifatah to have medical intervention for his heart defect. He was born with congenital heart defect, and he was hospitalized many times. and he needed an operation to fix that. We came to India, to Hyderabad, and then we contacted Apollo Hospital in Hyderabad. We were fortunate enough to meet with Dr. Sunil Kumar, who helped us tremendously as a family. He looked after Abdi Fatah, and we did some investigations, and he explained to us what the problem Abdi Fatah has, which was TOF, and that he needed an operation. He had an open heart operation. He was in the ICU, and then we were moved to the general ward. Alhamdulillah, he's now recovered well, as you can see him, and we are very thankful to Dr. Sunil and his team for looking after us so well, and all of the hospital teams, and the doctors who worked with him, the nurses, and everyone was very helpful. Thank you.